Good morning, good afternoon, and good evening, colleagues, friends, and members of Global Critical Care, Nephrology, and allied specialties. A very warm welcome to all of you on behalf of NephroCritical Care Society. It gives me immense pleasure and a sense of quite pride to welcome you to what is truly a landmark moment for our society, and especially to me also. Our first ever global webinar dedicated exclusively to the research in nephrocritical care. As we step into 2026, we felt it was the right moment to pause a little bit and reflect not just on what evidence tells us, rather, I would say, how we read it, how we interpret it, and how responsibly we apply it to our patient care. So, this would be the first ever global webinar dedicated exclusively to the research part. And we are now happy that, yes, we have the experts from the globe, and this is something is a pride moment as nephrocritical care sits at the crossroads of complexity. Our patients in the ICU who are having nephrocritical care ailments are physiologically fragile. Our patients are somehow expecting better care and decisions at the right moment. Our decisions are time sensitive, and yet much of the available evidence right now we have, they are extrapolated, heterogeneous, or statistically persuasive. But always it is not adding to the value, or sometimes we say that we are doing it out of the, I would say, difficult situations. We sometimes get success, but sometimes we also fail. Now, this webinar was conceived with one core belief, that is, research is not just about numbers, p values, or guidelines. Rather, it is about judgment, context, and moreover, interpretation. Now, tonight's program is something what we from the Nephrocritical Care Society has thought a long time from. And for those joining for the first time in our initiatives, a brief word about the Nephrocritical Care Society. This is a society, a clinician driven academic body committed to advancing nephrocritical care education, fostering global collaboration, and building context relevant research capacity. And we are about to release also, or like going into the different research like initiatives also. Our globe RRT survey is in the final stage of the manuscript writing, and hopefully we would be also expanding to other academic courses and review programs in the near future. Now, today's webinar is a natural extension of what we do, and a session of this academic depth requires experienced leadership. And I would be very happy, and right now I can say we are privileged to have two outstanding chairpersons with us. It is my honor to introduce Dr. K.R. Ramanathan, Senior Consultant in Cardiac Thoracic ICU at the National University Hospital, Singapore. He is also the Adjunct Professor, Associate Professor at the Young Lu Lin School of Medicine. He is the Research Lead at ELSO. So, welcome, Dr. Ramanathan. Now, Dr. Ramanathan is internationally respected for his clinical acumen, academic rigor, and balanced approach to evidence in complex ICU decision making. Joining him is Dr. Prasant Nasa, my dear senior from my training period. He is an intensivist and anesthesiologist at the Royal Wolverhampton NHS Trust Hospital, UK. He is also the editor on rational use of IV fluids and a globally recognized voice in fluid stewardship, ARDS, sepsis, and Delphi methodology. Together, they bring depth, clarity, and thoughtful moderation for today's discussions. Now, coming to the most important thing, our first talk sets the foundation for the evening. And the topic title we carefully thought about and finally restart producing and interpreting trustworthy clinical practice guidelines, nephrocritical care perspective. This session will be delivered by none other than Professor Bram Rochberg, intensivist and clinical researcher, from McMaster University, Canada. Professor Grossberg is a global leader in evidence synthesis and guideline methodology. He is also the chair of the internal medicine section at the Society of Critical Care Medicine. He is the chair elect of the Canadian Critical Care Trials Group. He is also the vice chair of the Surviving Sepsis campaign and also associate editor for leading journals, including Critical Care Medicine and CHEST. Now, there is perhaps no one better than him to help us understand how guidelines are truly built and where their strengths and limitations lie. Now, just to conclude in the same line, our second talk addresses a question every clinician, including me, struggles with: when numbers mislead, interpreting research beyond statistical significance. Now, this important session will be delivered by Professor Dr. Rakesh Garg. He is professor of oncoanesthesiology, critical care, pain, and palliative medicine at a very reputed AIMS, New Delhi, India. Professor Garg is a former editor-in-chief of the Indian Journal of Anesthesia and the Journal of Oncoanesthesiology and Perioperative Medicine. He is a reviewer of over 1,000 manuscripts and a mentor to generations of clinicians, researchers in India and beyond. Now, this talk promises to challenge how we equate statistical significance with clinical truth. Now, with this, I would now like to hand over this session to our esteemed chairpersons, Dr. Ramanathan and Dr. Nasa, who will take the proceeding forward and guide us through what promises to be an intellectually stimulating and thought-provoking evening.